Good morning, guys. Let's talk about estrogen. Should we block it? Should we control it? Or should we let it run free? The answer to that question is we should control it. Now, why should we control it? Well, in order to understand the answer to that question, you need to understand the role of estrogen within the body. Estrogen is really important for cardiovascular health, bone strength, mental health. There are lots of important roles that estrogen fulfills. You don't want too much, you don't want too little, you want balance. So you want a nice balance between testosterone, estrogen, and dihydrotestosterone. And appreciate that the complexities extend further than that, and all hormones are dependent, whether that dependence be direct or indirect. They are certainly not independent. So let's first tackle the HPG axis, the hypopituitary gonadal axis. Estrogen is the hormone that feeds back to the hypothalamus and pituitary to tell the brain whether you need to produce luteinizing hormone and follicle stimulating hormone, which sends signals down to the testicles to produce testosterone and sperm. If you have too much estrogen, there's a negative feedback, so those signals are not sent down to the testicles. If you have too little, the brain responds and sends LH and FSH down to the testicles. So it's control. You see? Control. So if you have an artificially elevated estrogen from an exogenous source, or you have a propensity to aromatization because you're a chunky monkey, or you have mild liver dysfunction or severe liver dysfunction, you will have an increased level of estrogen, which will be essentially tricking the brain, telling the brain that you have enough testosterone, ergo you will not send the signals down to the testicles. So the answer is control. Now, does that extend further? The answer to that is yes. So the primary sites where the aromatase enzyme are produced is the testes. So the role of estrogen in the testes is to help spermatogenesis, the production of sperm. And there's also a role in keeping the epididymis healthy, and that's the sort of spaghetti junction behind the testicles. So fertility. Estrogen is necessary for fertility. HCG. Now we use HCG as our gold standard because we want to mimic luteinizing hormone. So we want to optimize intratesticular production of testosterone and maintain testicular function. We have, I think it's 19 pregnancies now with the concurrent use of testosterone and estrogen and HCG. So HCG mimics luteinizing hormone. So we want to maintain testicular size, we want to maintain testicular function. It makes sense. The slightly complicating factor is titrating the dose according to response. Now that primarily comes from the fact that luteinizing hormone is sent down to the testicles in a pulsatile manner. It is not a continuous ebb and flow. So HCG, we're essentially trying to establish stable levels, and so your testicles are being stimulated constantly. So it's a matter of titrating the dose. But some guys do complain of excess estrogen as a result of HCG. And that really should be sorted out by titrating the dose appropriately and looking at other ways that you can reduce aromatization. And that's primarily looking at weight management and optimizing liver function. So testes. Let's go into liver function. Liver function is interesting because the aromatase enzyme isn't traditionally produced in a healthy liver. However, with liver dysfunction, the aromatase enzyme is expressed. So we tend to pollute our livers either involuntarily or voluntarily, and we do have a propensity to aromatization because of mild liver dysfunction. So you need a nice, healthy, clean liver in order to minimize excess aromatization. What else? Adipose tissue. So again, chunky monkeys tend to have a problem with aromatization and produce excess estrogen. So weight management is a cardinal thing that we address here at the Men's Health Clinic, because you don't see chunky monkeys in nature. Chunky monkeys in nature would be killed. You don't have to be the fastest, just don't be the slowest. So controlling estrogen makes absolute perfect sense. What else? Brain function. Estrogen. Estrogen is important for brain function, especially mood. Guys with excess estrogen, the cardinal symptom they present with is anxiety. I believe that actually within the normal population, because of our propensity to aromatization, because of us being chunky monkeys and having mild liver dysfunction, we have a propensity to aromatization, and that is causing an exacerbation of the epidemic of guys with mild anxiety. And I think that's something that needs to be addressed. There's also an association between excess estrogen and obsessive compulsive disorder. So brain function, incredibly important. Bone strength, cardiovascular health. Estrogen is incredibly important. It has traditionally been thought of as the female sex hormone, and that needs to stop, obviously, because there's an absurdity to that statement. It is an incredibly important hormone for libido, for brain function, for cardiovascular health, for bone strength, to name a few. So how do you go about minimizing the negative consequences of having excess estrogen? As discussed, the obvious answers are addressing your lifestyle, minimizing toxins, weight management, and avoiding alcohol. Titrating your dose accordingly to make sure that your estrogen stays within normal physiological parameters for optimal health. If you cannot do that naturally, if you cannot do that via alteration of your injection frequency or route of administration, as you guys know, I'm a big proponent of subcutaneous injections. For that very reason, it decreases the rate of aromatization. We use examestane, not anastrozole. Examestane, we microdose that, and that is something called a suicidal aromatase inhibitor. So essentially it kills a small proportion of the aromatase enzyme. It's the logical, methodical approach to addressing this issue. So when we talk about estrogen, you need estrogen. Estrogen is incredibly important. But just think back to that HPG axis as a perfect example of why you don't want excess estrogen. You want the correct amount of estrogen. That negative feedback loop is there to help optimize your male androgen levels. Excess estrogen causes suppression, and you do not send signals down to the testicles. Too little estrogen causes stimulation of LH and FSH. So when you talk about blocking, control, letting it run free, you control it.